Hello, and welcome to this episode of Case Studies in Medical Coding. Today we are going to look at outpatient care for reporting cases of dehydration, especially with the way the heat has been attacking the entire country. We thought this would be appropriate and helpful, right? So let's take a look. First, let's start with what is dehydration? And it's simply the loss of fluids within the body when it's greater than the intake. So in other words, there's no balance of fluids in the body. All of your organs and tissues require fluid, some type of fluid, to function properly. And when this is out of balance and the level is too low, kind of like, the oil in your car, right? If the level is too low, then the engine is going to seize up. Well, in the human body, if your level of fluids is 6 to 7% too low, that can actually cause the patient to feel dizzy and fatigued. And fatigue is, tired. Not just sleepy, but when your whole body is tired. Losing more than 10%, in other words, 10% loss of fluids, can actually affect your brain function, and the patient's mental confusion and physical deterioration can start to be evidenced. And as little as a loss of 15 to 25% can actually cause death. Can you imagine that? But maybe you've heard of, third world countries where they don't have clean water to drink and people are dying. Well, it's hard to imagine that happening in the United States, right? But it happens anyway. And in this extreme heat that we're going through, it's more likely to happen if you and your patients don't pay attention. So let's take a look at the most susceptible patient populations, and most likely wherever you are practicing, you are encountering people in these categories. So first we have our senior citizens. 65 and older is the phrase, okay? And the first bullet you see, insufficient intake of water and other hydrating drinks, is kind of like, well, that's the definition of dehydration, okay? But they are more likely to not meet that necessary minimum. Immobility can prevent refills. So, if the patient is unsteady on their feet or disabled in any way, it may be too much physically for them to get up and go refill that glass. And I have to say, if you look down for a second at infants and children distracting activities, this works for basically everyone, the entire population. It includes me, as I'll be working at my desk and I'll notice that my glass of water that I keep on my desk is empty. So I go, okay, I have to go refill it, but let me just finish this first. And the next thing I know, it's 3 hours later. So that immobility to prevent refills can easily be distractions and concentrating on other things. And so for people of all ages, right? And we say infants and children distracting activities, they're playing outside. But we also have 20 and 30-year-olds playing outside, right? You're playing basketball, you're playing tennis, you're doing things outside in the heat. And again, you get so busy with your activity that what's preventing refilling that glass of water is just, oh, I'll do it in just a minute. Okay? So that immobility can come from the distractions of working and doing other things, as well as physical limitations. Okay? And as the body ages, we know that the thirst mechanism that occurs in their throat can become impaired, and so they don't really feel thirsty the way the rest of the population may. So this means that we have to be more attentive to our patient population in encouraging them to drink. But if they're watching TV, take a look at the TV commercials. Splashes of water, drink our drink. We're going to talk about those in a minute. Okay. Chronic illness patients, okay, especially those with diabetes, mellitus, and renal disease, are particularly susceptible to dehydration because their illnesses actually impact the way their bodies are using fluids within. Okay? And polypharmacy, I have to just tell you that I came upon this term as I was researching for this presentation, and I love it because it's so, for so many people, okay? Polypharmacy, poly meaning multiple, pharmacy meaning medications. These are prescriptions, okay? I'm going to tell you absolute true story. Many years ago, my father and mother came to visit me, and they were in their 80s, and of course they had multiple medications prescribed by multiple physicians. Okay, and my father had a TIA, trans-ischemic attack, and for those of you who may know, this is kind of a little aside, but it's a default diagnosis. It means we can't figure out what caused it, so we're going to call it that. But dehydration was listed as one of his symptoms. And I went and I decided, with the knowledge that I have as a coder, I went and I inspected all of his medications. And I mean, not just looked at the labels on the bottles, but I sat with the PDR, the physician's desk reference, or now I would just go into drugs.com and take a look at the details of these medications. And you know what I discovered? I discovered that like 3 or 4 of his medications were not considered diuretics, but each of them had a diuretic property. So it wasn't enough in and of itself. However, because the medications were prescribed by different physicians, nobody put 1 and 2 and 3 together to say, well, the cumulative diuretic factor in each of these 3 taken together in the same body caused dehydration. So it's very important that we look at polypharmacy, patients who are taking multiple prescriptions, that again, one or none of them might be categorized as a diuretic, but still might have that quality, and can be compounded by multiple prescriptions with that same hidden factor. It's something to consider. Okay, so let's determine a diagnosis. And again, we talked about mental confusion. We talked about dizziness and fatigue, which are very easy. Those of you who have spent any time out in the sunshine at the beach, that may seem very normal, and it is normal, but to what extent do we go from normal to potentially damaging to the body? Okay, so we're going to go to the doctor, physical exam, vital signs. You already know this. That's your regular E&M code. But now we're also looking at the physician checking the levels within the body. So most often the test would include the electrolyte panel 80051, CPT code 80051, which is looking for, in this particular case, specifically levels of sodium and potassium and chloride in the patient's body. Because those, again, that's where you're going to see that danger level first. The renal function panel, you all remember, renal is kidneys, 80069, which includes levels of creatinine, glucose, and urea nitrogen, which again are all indicative or potentially indicative of dehydration. And osmolarity testing. Now this can be done with a blood specimen or a urine sample. So you have to check the documentation to find out if a blood specimen was used. You're going to use CPT code 83930. If a urine sample was used, you're going to use 83935. Now, depending upon where you're working, these lab codes may only be reported by the lab that is conducting the tests. But there are a lot of clinics now and doctor's offices and outpatient offices that have in-house labs. So as appropriate. But remember, only the entity that performs the action gets to code for the action. All right, so let's go. We now have our test results back, and we're looking at ICD-10 diagnosis codes for volume depletion, the medical term that includes dehydration. And guess what? There's only one code. Right? Those of you who have experience with ICD-10-CM, is like, there's always little definitions and additional characters to give us more detail, which is so incredibly important. But E86.0, dehydration, nice and simple, straightforward. The only thing you need to be on the watch for is your patient 28 days or younger, a newborn? If the newborn is dehydrated, you're going to report that from P74.1. But everybody 29 days of age and older, one code. Okay, that's how simple, right? Very straightforward, very good. The doctor writes it down, you report it. But, you know, our job is to tell the whole story. The whole story about what's going on with this patient. So we also have to check the documentation for contributing factors toward this patient's dehydration. Now, vomiting, persistent vomiting, bilious vomiting, definitely a fluid outtake far above, okay? Which is why you may see those Pedialyte commercials, you know, where they show people who have the flu, diarrhea or vomiting. We're talking about excessive output, that if the patient is not actively inputting the right things, like water or electrolyte fluids like Pedialyte or Gatorade, but soda, hot tea, coffee, they may look like fluids, but they are not going to help combat dehydration. So if the patient reports that they have been persistently vomiting or have unspecified diarrhea, we need to report that as a contributing factor to the dehydration. The dehydration is going to be your first reported code, but we also need to be complete because there's going to also be care provided, maybe a prescription to stop the vomiting or the diarrhea, okay? Excessive sweating. Medical term, hyperhidrosis. Hyper meaning above normal, hydrosis meaning sweating, the release of fluid from your body. Okay? Now you know what normal sweating is, and there are people who have hyperhidrosis. Also, there is a long list of medications that can cause a patient to develop or exhibit hyperhidrosis. So we want to look at that as well and see if the doctor documents that as a contributing factor. And as appropriate with the weather out there, at least right now, and our heat dome, we want to also look at using external cause codes of heat stroke, T67.01XA for the initial visit, and heat exhaustion. Okay, I can say gastroesophagoduodenoscopy, but I can't say exhaustion. Okay, oh there, I fixed it. Okay, heat exhaustion and anhydrotic, which is heat prostration due to water depletion. So again, you know, falling asleep at the beach, these are things that are part of everyday summertime activities, but can be extremely detrimental to the patient's health. Now, also, there may be comorbidities, and we mentioned this before: diabetes mellitus, kidney disorders, and also any gastrointestinal diseases such as ulcerative colitis or Crohn's disease, which can, again, cause diarrhea. But these are elements that are part of the body's development of dehydration. So, of course, we need to also put this as a secondary diagnosis code because it is a contributing comorbidity. There's no separation here. It's actively involved. Okay. I mentioned before, and I wanted to include this slide to just give you a quickie look at those medications, prescription medications, that are known to cause hyperhidrosis, excessive sweating, which can contribute to dehydration. SSRIs, opioids, antimicrobial antibiotics, corticosteroids, thyroid drugs, and of course diuretics. All of these drugs are known to be potentially contributory to a case of dehydration. And again, when this is documented, and you might need to query the doctor, we want to make certain that we are reporting this because it is part of the whole picture. What is going on with this patient? Why is this patient suffering with this condition? You already know, or probably know, just from studying anatomy and physiology, how complex the human body is, and how everything, even those parts that seemingly have nothing to do with other parts, still affect other parts. Okay? So remember that medical coding is not only for reimbursement, which would be important to, again, support a prescription for a medication or a treatment or whatever the doctor may prescribe, okay? But, or I should say, qualified health professional. It's not only doctors, nurse practitioners, okay. But the point is that we also code for research. We code for understanding of trends that are going on in the human body and how we can use that information to help future patients as well. So we code for far more than reimbursement. So don't just look at it as what's going to get us paid, especially when we look at quality payment programs. This is all going to be part of attesting to the quality of care and not just wham bam, thank you ma'am, doctoring. Okay, so now we're going to treat this patient who has dehydration, and for the most part, treatment for dehydration is done with an infusion, intravenous infusion. And as you may or may not know, whenever you are reporting the administration of a medicinal substance by a healthcare professional, you're always going to need at least 2 codes. Always at least 2 codes. You need the administration code and you need the code for what's inside that, what was getting administered, okay? So part 1, the administration code, based on the length of time spent for the infusion procedure, and make sure you keep your eye on intravenous infusion. Make sure it was an intravenous infusion, okay? And in this case, specifically for hydration, we have CPT code 96360 for the first 31 minutes to an hour, and add-on code 96361 for each additional hour. If less than this, please see your CPT book and their guidelines, and that will tell you how to report less than 30 minutes or less of intravenous infusion. But this is the norm when we are talking about a patient diagnosed with dehydration. So the administration code we have there for intravenous infusion hydration specifically, okay? And then we have to report for the medicinal substance, what was being infused. Here are 5 HCPCS level 2 codes. Typically, it will be a HCPCS level 2 code, often a J code. Why am I not saying always? Because there is no such thing in healthcare as always, okay? Oh wait, I just thought of one. Always read the documentation carefully and interpret what is there. Okay, so we have J codes, J7030 for the infusion of normal saline solution 1000 cc's. So here we are looking for exactly what was infused, which is in this case normal saline solution, as well as the quantity. All right? Because it's not unusual for an infusion to be less than or different, okay? So if you look down on our list, you're going to see J7050, infusion, normal saline solution, 250 cc's, not 1000 cc's, okay? So we have to look at that because that's going to affect how we report this. So if the documentation says the patient got 500 cc's, you would report J7050 times 2, and J7030 would be fraud because you would be overcoding because the patient did not receive 1000 cc's. The patient only received 500 cc's. Okay. So be very, very careful. Make sure the documentation is complete. And now you know how to report a case of dehydration outpatient. All right. Well, keep learning, and thanks for joining me today.